Keeping an eye on your health, January is Birth Defects Awareness Month, and according to the Centers for Disease Control and Prevention, birth defects impact 1 in every 33 babies in the United States and are responsible for 20% of all infant deaths. And joining us now is Dr. Beth Carew, an OBGYN with Rose Medical Center. Thanks so much for joining us today.
Thanks so much for having me.
Yes, so this is all really good information. Birth defects, it can happen for a lot of reasons. What are some known causes?
Yeah, so there's a lot of different causes of birth defects, and some of them are things that we can modify, such as activities that, we engage in, or parts of our, medicines that we're taking, or, problems that, other medical problems that we have that put us at higher risk for birth defects. There's also just some causes that happen that we don't fully understand, chromosomal problems with division and formation of, these really vital organs such as our hearts and our brains during early pregnancy.
What are some examples of common birth defects?
So the most common birth defects are chromosomal problems such as Down syndrome, which is a chromosomal problem where you have an extra copy of one of the chromosomes. Problems with heart defects, so congenital heart defects, and there's a lot of different kinds of congenital heart defects. And then as well as other structural problems such as cleft lip and palate, where there's, problems with the formation of, some of the facial structures.
Are these preventable? And if they are, what can expectant mothers do to make sure their babies are healthy?
Yeah, so some of these are preventable. One of the things that moms can do to help prevent certain birth defects is taking a prenatal vitamin, or a vitamin that has folic acid, at least 400 micrograms. At least 1 month before they conceive, ideally up to 3 months before they conceive. So generally what I tell patients is when you start thinking about expanding your family, that's a great time to start a prenatal vitamin. And then other things that moms can do is make sure that they see their doctor and talk about any medications that they're taking. There are certain medications that can increase, risk for birth defects. And then making sure that they're optimizing their health. So healthy lifestyle, achieving a healthy weight, exercising, avoiding things like alcohol, smoking, and other drug use that can be linked to birth defects as well.
And a lot of times, moms, they don't know that their babies have birth defects until after delivery. Walk us through what that's like for a family.
Yeah, I mean, that can be really hard for a family to be surprised. I think we're very lucky here, in Colorado to have hospitals that, are equipped with, nurseries and pediatricians, and we've got really great specialists here who can, help families walk through some of those things. I always say the best thing is to try and know about as much as we can before pregnancy or before delivery. And so making sure that, getting regular prenatal care, having, screening tests done, making sure that, we're testing for things so we can have that information and have your healthcare team set up, before delivery.
Yeah, it seems like that communication is really important. Dr. Carew, thank you so much for joining us today.
Yeah, of course. Thanks for having me. Take care.
Thanks. Happy New Year. And remember, you can watch all of our health interviews right now on cbscolorado.com.